start my examination by looking the consent of the patient. Then I will examine the gross looking of the hands of the patients, and after seeing with the neck type, I will examine the hands of the patients with my torch. And after seeing the, I will assess the sizes and number of these lesions and the surrounding skin, as these are the plaques of the variable sizes, and mostly of the rounded to oval in shape, having central areas of the atrophy and the violaceous borders. And then I will, or many of these plaques are showing the crusting over the surface. So I will going to squeeze these plaques to check for any bloody or serous discharge or any grains coming out of it. Then I watching the surrounding surfaces which are showing the any atrophic areas or post-inflammatory hypopigmentation or hyperpigmentation. Then I will go for checking the temperature and tenderness of these plaques, and I will do the diascopy also for checking any Pulsali nodules or any telangiectasias in the surrounding. And I will also look for the loss of the hair or the excessive hair growth over the surrounding areas. Then I want to check the joint movements over these plaques and over the hands, especially of the wrist joints of the both hands. And then I will examine the joints of the fingers, and for any swelling or for any signs of any bony involvement like tenderness of these joints, or then I will examine the joints of the elbow and axilla. Then I will check for any lymphangitis on the forearms and the upper arms by examining the girth and for looking for the congested vessels. Then I will do the axillary lymph nodes examination, cervical lymph nodes examination. Then I will do the check the anemia of the patient, if because the it is related to the chronic disease. Eye examination, nasal cavity examination, oral cavity examination. Then I will check the lymph nodes, cervical of the patients, and then I will auscultate the for the respiratory system from the back and front of the chest, and then I will do the chest auscultation from the front of the chest, and I will do the abdominal examination for the any visceromycelie and for any tenderness of the abdomen. On the basis of I will also check other any cutaneous body areas having the same type of the lesions like this. And according to my examination, my differential diagnosis are Eumycetoma, Actinomycetoma, and Scrofilloderma, and Botryomycosis. Now I will give the findings of the examination per examination scheme. Thank you for giving me the command. My patient is fully cooperative and comfortably sitting in the chair. On examination of the hands, there are multiple atrophic papules and plaques present on the dorsal aspect and palmar aspect of the left hand are in the confluent distributions, and they are of variable sizes and roughly rounded to oval in shape, and mostly these plaques having the central area atrophy, and other having the central sinuses. Some of the sinuses are covering with the reddish granulating tissues, and others are on the plantar palmar aspect of the hand covering with the yellowish brownish crusting. The surrounding areas of these plaques showing the showing the atrophic skin, and the margins of these plaques are well defined, and having the violaceous hue, and there the hairs in over the skin is in the normal distribution. There is no hair loss. There is no tenderness over the lesions, and the temperature gradient is normal, and the sensations are intact. The patient is moving his small joints and the large joints like wrist, elbow, and shoulder joints freely in all the directions without any pain, and there is no tenderness and swelling or erythema over the concerned joints. On further extension of my examination, I examine the pulses which are bilaterally, which are normal volume and the character, and there is no radial delay. There is no abnormal girth of the limbs, and there is no signs of the lymphangiectasias or any lymphangitis evident on the concerned limbs, and there is no axillary lymphadenopathy. On further cutaneous examination, I examined all the relative areas of the skin, and there is no other such lesions over any area of the body, and there is no jaundice or anemia. The oral and nasal cavity are normal. There is no cervical lymphadenopathy, and the respiratory on respiratory system examination, there is a vesicular breathing with the sounds of the normal intensity, and no any abnormal sound is audible. And on the abdominal examination, the abdomen is soft, non-tender, there is no visceromegaly. On the basis of my examination, my differential diagnosis are scleroderma, actinomycetoma, eumycetoma, and botryomycosis. And thank you. And I have forgot to examine the to tell the nail about the nails of the patient and interdigital spaces of the patient. So I have to mention these. And also I want to do the endoscopy to check for the adpulgent nodules which are negative in this case. Thank you.